All right, so I just began the recording portion. Welcome everyone to the UNC Hearing and Communication Center's virtual Better Hearing webinar series. We usually have these groups talk in person, and since this is the first time going virtual, I do want to share that we miss all of you and we miss seeing your faces in person. So since this is the first time navigating virtually, I encourage everyone to share your feedback with us today, either by emailing Dr. Whitson or emailing our general HCC address, which is unc-hcc@med.unc.edu. Today's topic is about communicating in public with face masks. My name is Anne-Marie Egan, and I will be presenting today's topic. A little about me: I will soon be a graduate of our Doctor of Audiology program, and I am currently a graduate student at UNC Chapel Hill. I fill the role at our clinic of the fourth-year extern. And Dr. Whitson, who is also on this webinar, has worked tirelessly in the past year to help bring this webinar series to life. So thank you, Dr. Whitson, as well, for making today possible. A little bit about our clinic, in case people are not as familiar with us. We are a nonprofit practice of faculty doctors of audiology. We are affiliated with the UNC School of Medicine. We serve as a training clinic for students going through the Doctor of Audiology program at UNC, and we teach on-the-job training for graduate students from their first, or in my case, to their fourth years. We primarily fit hearing aids, and we work with all hearing aid models and manufacturers. One thing that sets us apart is that we run our clinic based on an unbundled or fee-for-service model. This allows us to not only be competitive with pricing, and we all know how expensive hearing aids can be, but it also allows us to be transparent with what you're paying for. We pride ourselves on ethical hearing aid fittings using best practice, standards, and transparency. In addition to focusing on improving hearing abilities, we also offer balance and tinnitus specialty testing. We also recently opened a satellite clinic in Hillsborough, North Carolina at the Orange County Sportsplex. Dr. Patricia Johnson sees patients there on Thursdays and Tuesdays. To be scheduled in Hillsborough, you can call our main office number and request the Hillsborough site. Our number is listed on this slide, and it will be listed again at the end of the talk. Before we get started, I want to give a brief overview of our plan for today. We'll start with a quick review of hearing loss and the hearing system in general, along with how hearing loss affects communication. Then we'll get really specific about how the pandemic protective measures affect communication, which leads us to our main discussion, which is strategies to overcome these obstacles. At the end, we will look at the chat box to answer any questions you may have. All right, let's get started. So a little background: hearing loss is very common. It is the third most common health problem in the United States after both heart disease and arthritis. 1 in 3 of adults over age 65 to 74 years have hearing loss, and 1 in 2 when they're older than 75. So truly, the takeaway here is hearing loss affects a lot of us. Hearing loss is a gradual decline for many people, especially when it is related to age. It happens slowly over many years. As a result, many adults ignore or simply don't notice their hearing loss until it has kind of precipitated over time. On average, the hearing aid user will wait over 7 years after their initial diagnosis to be fit with their first pair of hearing aids. And there's more and more research coming out on how early intervention can be beneficial. So 7 years is definitely 7 years too late. A review of how our hearing system works. There is the outer, middle, and inner ear. The outer ear has that ear canal that earwax can get trapped in. There's those middle ear bones, and then there is that inner ear organ, the cochlea. So to give you a little more detail, this is a moving image, and it shows the sound waves hitting the eardrum, going through those middle ear bones, and then becoming a signal that is sent from the cochlea up to the brain through that nerve. And there can be hearing loss in any part of this pathway. To zoom in even further on that inner ear cochlea, you can see that it is a very fine structured area with many different parts and pieces, and this entire space is the size of the tip of my pinky, about 9 millimeters in diameter. And so you can see just how easily this system can become harmed from many different things, purely because it is so complex and so small. So to talk about the different parts, the outer ear, if there is something causing hearing loss there, it would be called conductive hearing loss. Most commonly, that would be due to something like earwax or an ear infection. And in some cases, this can be corrected by surgery or medicine. So often an ENT physician will look at these cases as well. The picture on the right corner of the screen is an eardrum that has fluid and air bubbles on the inside. And this is another example of having fluid by those middle ear bones, impacting the sound reaching the cochlea and the rest of the hearing pathway. So it blocks the sound from going farther up. Sensory neural hearing loss is truly the most common kind of hearing loss, and the most common kind is age-related. So sensory neural hearing loss is the result of degeneration of the hair cells in that inner ear cochlea region. And this can happen for so many different reasons: genetics, noise exposure, so rock concerts, power tools, shooting ranges, diseases and infection, medications, chemotherapy, the list goes on and on. To give you an idea of what is happening, the picture on your bottom left is a microscopic image of all those different hair cells in someone who has normal hearing. On the right side, you can see that there is damage to those hair cells, and they're either distorted and misshapen or missing altogether. And so the end result is a sound that reaches the brain that is not only softer than it should be, but more muffled as well. It's also important to note that we hear with our ears, but we understand or process the sound at the brain. And that is an important thing that an audiologist learns about in the hearing test, because we want to know how much of your hearing ability is based on the hearing pathway and how much of it has to do with the processing of the information itself. Now we're going to move into communicating with hearing loss. So communication breakdowns are when one person says something that is not understood or received by the listener. Obviously, this can happen with people who have normal hearing, but we are going to talk specifically about communication breakdowns when someone has hearing loss. So there are many factors that can cause these breakdowns. There can be background noise, reverberations, so a very open floor plan and the sound waves are bouncing around. You could be very far away from a sound source, so it's even more difficult to hear. It could be hard to see the person's face. Your hearing status can further impact how well you can hear, and the familiarity of the speaker's voice or accent, as well as the context of the situation, can further cause a communication breakdown. So how does hearing loss affect our communication? Well, when someone has hearing loss, there might be a greater need for repetition. There might be more interruptions in conversation, long silences while someone processes or catches up with what is being said. There might be misunderstandings when someone misses part of a word and guesses incorrectly. Sudden topic changes because of miscommunication, superficial conversation because it might be easier or safer for someone to talk about what they already know, and one person leading the conversation with that same idea of, if I'm the one talking, I don't have to worry about what they're saying to me. And all of these things can lead to feelings of frustration, anger, blame, and shame or guilt from both parties, but particularly the people who have hearing loss, and that is a real challenge. So how do we repair these communication breakdowns? Well, we need to use different strategies to help the speaker and how they communicate, the message that is being sent out, the environment, and the listener who's receiving the message. So what can we do to help the speaker? Well, the speaker can speak slowly and clearly. Yelling can further distort the message being sent. The speaker can insert pauses in between sentences. That way the person with hearing loss can have time to catch up and process what's being said. The speaker can make sure their mouth and face are visible when it's safe to do so, and that allows for there to be lip reading and facial cues. The speaker can avoid speaking and chewing at the same time. Chewing can distort the lip shapes that people rely on. And the speaker can avoid speaking from another room. That distance and those corners are hard for the sound waves to travel. There can be things to help the message being sent. Repeating important keywords such as a date or time, so that if someone misses them the first time, they have a second opportunity to catch those later on. Rephrasing the sentence so that if someone missed a particular word, using a different word that might be easier for them to hear, they catch things the second time. Using simple grammar so that the sentence is easy to understand, and to avoid pronouns and be specific with names. So if someone's having difficulty hearing the difference between he and she, saying Cynthia and Edward would be very helpful in clarity for the conversation. And using shorter sentences so that the other person has the opportunity to ask questions or catch up with what's being said, versus having a very long sentence and the listener being confused about what was said at the very beginning. They will definitely be very confused by the time you get to the end. There are modifications for the environment. Limiting background noise, such as turning off the TV or asking for a quiet table at a restaurant. People with hearing loss often have additional impairment in background noise, and reducing the background noise will allow them to pay attention on what is truly important. Moving to a well-lit area for good visibility of the face, again, goes back to that idea that people rely on facial cues. Getting rid of distractions and multitasking. If someone's looking down at their phone, you lose the opportunity to see their face and engage with them in those manners. And to stay close, again, when possible, because it's going to be easiest to hear someone when you're 4 to 6 feet from the sound source. Modifications for the listener. The person who is trying to hear can use assistive devices or hearing aids. A lot of hearing aids have directional microphones, so facing the person that you wish to hear can help direct the sound with the hearing aids. Speech reading ability can also provide additional context. Concentrating on what is being said. So if there's an important conversation you want to hear, it will likely be easier for you to concentrate on it in the morning when you have more energy versus trying to talk about that topic when you're exhausted at the end of the day. Keeping a positive attitude, anticipating a good vocabulary. So for example, if you are going to a deli counter at a grocery store, know that the worker there might be asking what type of meat or how much, and to be able to have that word bank in your head before you get there so that it's less catching up in the moment. And to ask for written summaries whenever possible. So if you go to the doctor's office, most places do this now, but asking for that summary sheet when you leave, in case there was something that you might have misheard in the appointment. And this can be done for other things, like when you go to a mechanic, or if you go to a lecture, if you could get these slides printed out afterwards. And that ties into self-advocacy. So most people do not understand the problems associated with hearing loss, but that doesn't mean they don't want to help you. And it can be very scary and an uncertain feeling to advocate and reach out for help. But in all honesty, most people are compassionate and they do want to help, and they just might not know how. And so if you are comfortable, be willing to admit that you have hearing loss, and then take the lead to inform others on specific ways that they can help you, like asking for slides from a lecture. In this process, you'll need to be specific, you'll need to be very patient, and you'll need to be assertive. And everyone is on a different journey, and some people will be able to do this sooner than others, but I would say that most people do not regret reaching out, and most people end up having a good positive experience from it. So, how does the pandemic and protective measures affect communication? I'm sure everyone on this webinar has their own story to tell at this point, and I'm going to go into the details of some of those. PPE, or protective equipment, and social distancing affect communication greatly. Masks take away visual cues for speech, such as lip reading. They take away facial expressions that give us information about our mood, our tone, and our reaction. Masks can reduce or muffle the volume of the speaker's voice. They can distort, and especially if you're at a distance, that can make speech even softer. Plexiglass and plastic shields further reduce or muffle the volume of speech, and often people are wearing masks behind those, so you almost have a snowballing effect of hearing difficulty in these situations. Face coverings take away visual cues. 60% of a person's attitude can be determined by their facial expression alone. Well, when you have a face mask, we are now only working with our eyes and our eyebrows, so you better hope that that person has very revealing eyebrows in those situations. 45% of communication is verbal, but 55% is nonverbal. So losing the small nuances of how someone is expressing with their face are really critical. For those with hearing loss, being able to see people's lips and faces is vital for speech understanding. Masks then reduce the volume of the speaker's voice, specifically in the high frequencies. To add on to that, high frequency sounds are more difficult to hear as we age. So hearing with a face mask would be especially difficult for older adults. Distances make speech softer. For every doubling of distance, the volume is cut in half. So if we're now 6 feet away from people, you would have to speak double the volume you would have when you were only 3 feet from someone. And unless you're an audiologist who works with this situation every day, my guess is many people do not compensate and add that boost in volume that we need. Plexiglass reduces volume, and I'm sure many of you have been somewhere like a checkout or a Starbucks where it's so difficult for parties to hear that, I often see people honestly leaning around the plexiglass to hear and understand, which makes the plexiglass a little redundant with our safety, but I think most people have seen just how difficult that can be. So what can we do to overcome these things? I'm sure at this point in the lecture, you're thinking, okay, Anne-Marie, I've lived this already. Now what can we do to help? Well, in regards to face masks, wear your hearing aids and increase the volume if needed. They're going to help with speech understanding, and they're going to give a boost in volume that you need. With that being said, make sure your hearing aids are clean and that the programming is up to date. If you haven't had a hearing test in 7 years, your hearing may have changed, and even wearing hearing aids might not be enough of a boost for those situations. Ask your audiologist about creating a custom mask program at your next visit. This can further give a boost because masks decrease speech sounds by about 12 decibels. So we can actually program to offset that difference. Normalize wearing clear face masks. The one on the right is from theclearmask.com, and there are more that are becoming common and available to the public. Look at faces, even if you can't read their lips. Like I said, at least we have our eyebrows, and with directional microphones on hearing aids, at least the hearing aid is helping you as much as possible that way. Let the person know you didn't hear them. Ask for repetition or to rephrase, and ask them to speak up clearly. And as we go through these other situations, you may notice a lot of these repeat, and that is true because in general, they are good communication strategies to follow. Our next is overcoming distance. So with that 6 feet instead of 3 feet, we're at a volume that is cut in half. So wear your hearing aids because they will help you compensate for that distance. Make sure they are clean and working. More specifically to distance though, consider using a remote microphone with your hearing aids. So these are brand specific to the company of your hearing aids, but all companies do have some version. And the little microphone can clip to the communication partner that you want to hear, and their voice would then stream directly to your hearing aids, just completely overcoming that 6 feet difference. Wear a clear mask if you are the communicator in the situation. Let someone know if you didn't hear them, if you are the listener. And again, ask for rephrasing, ask for them to enunciate and advocate when you're having these challenges. Other strategies for communicating when you do go into the real world, which I know is not that often for most of us. Use gestures and body language to compensate for the lack of facial expression. So using your arms, pointing, those kinds of things can add additional context. Make a game plan with whoever is entering a place with you that requires a mask. So if you and your partner were going to the deli to purchase meat, discuss ahead of time what you would like to order with them, so that if you're having difficulty hearing the worker, your partner knows what your plan is, and they can also help you either fill in the blanks or help between the two of you figure out what is being said and what is missing. Use a phone application to transcribe what other people are saying. So most iPhones nowadays have a speech-to-text built into their standard keyboard, and the iOS 14 recently released a translate app that can translate or transcribe live speech. We will go into more detail in our next webinar about different phone applications that can be helpful. So if this was interesting to you, make sure to come back next time. Be prepared to ask someone to write or type their message. So if you are having difficulty hearing at a bank and there's that plexiglass, slide a piece of paper under and have them write down the important things. I think you'd be surprised how many people are willing to help you when you ask. This next portion is a handout that our graduate assistant created to give you tips on communicating while wearing a mask. And so I will pause now at this point if you want to take a picture of this. And if you would like a copy and we're unable to take a picture, simply email or call us and we will be able to send that to you. Now, I know we're talking about communicating, but we are an audiology clinic, and so we can't go without saying, don't lose your hearing aids. There are a lot of different techniques that people have been using by this point. One is to use a button extension for your mask, and you can find these online. There are lots of cute ones on Etsy, and that keeps the mask sitting farther behind your ear so it doesn't twist with your hearing aid. You can buy or sew a mask that ties in the back instead of an ear loop around your ear. You can check that the hearing aid is in place before and after removal of the mask. So if you get in your car after going to the grocery store, take your mask off and then check that the hearing aids are still in before going home. With that being said, if you can wait until you get to a safe place like your car or your home before removing your mask, that way if the mask and the hearing aid do become tangled and the hearing aid falls, it will be a lot more likely that you find it and that it will be in one piece. There are other ways to keep your hearing aids secure in your ears when battling masks. If your hearing aids are loose, I definitely recommend talking with your audiologist for recommendations. In addition to securing the earpieces with things like kickstands, there are other methods that we can use for your devices, such as eyeglass straps, wig or toupee tape, oto clips, and ear gear covers. So if you have any interest in those, I recommend you reach out to your specific audiologist on that. So in summary, today we learned how to identify and repair communication breakdowns. We talked about how face coverings and other protective equipment can impact communication. And we discussed recommendations for improving communication in public during a pandemic. A lot of these overlap with each other. You know, wearing appropriate technology that is up to date, clean, and working well, using the context of the situation, preparing ahead of time, asking for clarity or for rephrasing, and having extra tools like a partner mic, a pen and paper, or a translation app can all help you in many of these situations. If you have specific questions, schedule an appointment with your audiologist and they will be able to help you with your particular situation. We discussed how to plan for communicating during a public event, and we talked about tips for face coverings and keeping those hearing aids safe on your ears. Our next webinar series topic will be using mobile apps and other technology to enhance communication in a virtual world. And that will be on Wednesday, March 3rd. And we will again post on our Facebook page and send an email out. And it is welcome for our patients and any communication partners or people who want to learn more about this topic. At this point, we will answer any questions that you might have from that chat box. And I'm going to leave it on this slide in case you have any specific situations that you want to email us about. I'm going to stop the recording, so thank you to all who have listened.